The role that radiology plays in cancer diagnosis includes the initial evaluation of the symptom that brings the patient to a cancer diagnosis. It extends through diagnosis to picking the appropriate treatment option, staging cancers, restaging cancers after treatment, and then continues on through the surveillance process detecting cancer recurrence. So the difference between screening and diagnostic imaging is that screening imaging is really tailored towards people who are asymptomatic and are being imaged for the purpose of detecting early stage cancers that wouldn't be clinically apparent yet. Diagnostic imaging is basically geared towards a patient that has a symptom, whether it be a mass or something internal like nausea or vomiting. That would be an example of where imaging is used for a diagnostic purpose. So the treatments that are performed by radiologists include medical therapies, like an example would be radioactive iodine that's administered orally for the treatment of thyroid cancer, through more invasive techniques that would include the ablation of tumors from the outside using like radiofrequency or microwave ablation, or through access via patients' blood vessels that will include treatment therapies like Y90 embolization of the liver. So it's actually a pretty wide spectrum of treatment options that radiology can provide depending on the cancer and the nature of the patient's disease. So recently approved procedures for imaging that have an impact on cancer care would include a lot of the functional imaging. New PET radiotracers are coming out that are more targeted for specific cancers, and that's having a big impact on radiology and imaging. The other thing is with MRI, with new pulse sequences that are coming out, or pulse sequences that are being fine-tuned, that are allowing us better imaging of specific tumor biology and how that relates to prognosis. I think what I'd like to say about radiology's role in cancer treatment is that we're part of the Northside family, and you know, Northside has done a great job, I think, of bringing really well-qualified, very good experts in lots of areas related to cancer treatment. And you know, as part of Northside Radiology Associates, we're happy to be part of that team and work with them on a daily basis, reviewing scans, being the tumor boards, doing curbside consults regarding their patients, and again, working for the best outcomes possible for everyone in the Northside family.